In this time of crisis in our community, when we're all struggling and facing this pandemic, we wanted to take a moment to reassure you that the ER and all our hospitals stand ready to serve any emergency needs you may have. Our emergency room visits across the entire region are at an unprecedented low right now. And that's really concerning to us because we know that illness still exists in our community. Human disease still occurs. People have heart attacks and strokes and abdominal pains, and we need to care for those. We want to really emphasize that the ER is a safe place to come get care no matter what your complaint is. We want to reassure our community that we're a safe place to seek care for all of your emergency needs. We absolutely can care for COVID-related complaints and cough and fever and shortness of breath. But just like always, the ER stands ready to serve any patient anytime for any complaint. One of our worries is that people may be afraid to come to the ER. But now is the time, if you're having these important symptoms of chest pain or shortness of breath or headaches or weakness or numbness, to still seek that appropriate emergency care. We've carefully engineered our operations to make sure that every patient is safe no matter what their healthcare needs are. Why don't we step inside for just a moment and I'll show you how it works. When you first arrive in the ER, we're going to have you present to our registration desk. We'll find out more about why you're here. We're going to take your temperature and we're going to put a mask on. Throughout your stay here, we're going to maintain social distancing and masking so that we protect you and all other patients while you're here in the emergency room. Even our layout of our triage area includes spacing between patients while they're waiting. And then as we move you through the process, our waiting room is broken into different sections so that people with cough or COVID-type complaints are separated from patients with other types of complaints. Even when you move back into a room in the emergency room, we have designated areas and rooms that are specially equipped to deal with COVID patients that are separate from areas where we care for all manner of other complaints like heart attacks and strokes and appendicitis and all the things that people come to emergency room for. We want you to know that the emergency room is a safe place to come for any of your healthcare concerns. Don't delay if you're having symptoms of chest pain or headache or numbness or abdominal pain. Call 911 or go to your local emergency room to seek care immediately.